Right, we're here with Rachel Zelon, the founder and president of Hunger Relief International, and our very own Pastor Emeritus, Dr.
Awesome.
Claude Thomas. Welcome to the Zoom world.
Yes.
This is the Zoom
Yeah.
world. It's our own little ecosystem here. Rachel, it is so awesome to see you. We have for about a decade, since the 2010 earthquake in Haiti, we've had a great relationship with Hunger Relief International through our wonderful church network called C3 Global, but also we partnered in specific ways and directly, and we're looking at that again right now in this crisis. Together, we fed over 1 million meals to kids, and we're so grateful for your vision to create a way to do that and to create a platform for that. So, man, welcome to the Keystone family here.
Yes. Thank you for joining us.
No, thank you so much for having me. Love it.
We're so glad. Well, in Keystone, we have been partnering for years with specific children to help them, to feed them. Tell us about the Keystone Orphanage right now in Haiti.
The Keystone Orphanage right now is actually at a good size. It tends to grow, and it's almost it expands and it gets smaller, and it's at a pretty good size right now. You've got 127 kids, which is a huge amount. Great leader in Pastor Keystone. We have been doing, as you well know, nutritional support. We provide, over the years, we've tried to improve and expand upon the food basket, even though inflation has gone through the roof. But we have eggs, we have dried fish, we have powdered milk, oil, basic staples. These kids are getting well fed and they're doing well. As part of our NEST program, your kids are always involved in receiving personal hygiene and sanitation trainings. It's so important. We work on gender equity. There's a lot of girls and boys of all ages. We need them to understand how to work with each other, how to deal with each other, how to deal with their changing bodies. We work closely with a pastor who's great on spiritual support. We have been doing all sorts of things. Psychosocial support is another piece that's really important. Susan, I think that's really your field, and you can really associate with it. There is so much stigma towards children that live in orphanages in Haiti. How do they deal with it? How do they get past it and feel good about themselves? How can we build their self-esteem? All of those pieces together, plus, of course, clean water and good sanitation, which luckily the orphanage is pretty good at, all of those together is what is going to take us to the best outcomes we can for these kids, and that you're investing in their futures and we're investing in their futures so that they have a chance to step up and not just step out, but up and out, so they'll be able to take care of their own families in a much better way. And what you've done is really to bless these kids with a future they never, ever could have imagined before.
Well, that's our heart. These kids are up against a lot. They're up against so much. And we're so thankful to partner with an organization where we can not only address their physical need, but it's mind, body, and soul. It's really addressing them as a whole person, hoping and praying to be a part of setting them up for a good future. So we're thankful for you, for your organization, just to be able to be a help.
And Rachel, we hear all the time on the news, at least I do, about Italy. We hear about Spain. We hear all kinds of crazy stuff about China. I mean, I don't even know what's going on there. And but what I have not heard a lot about are some of these really hard places like Haiti.
Yeah.
So can you help us understand how this crisis impacts the people of Haiti?
It's huge because we have so many factors that play into it. So a country like Haiti, the poorest country in the Western Hemisphere, one of the 15 poorest countries in the entire world, over 60% illiteracy, close to 70% unemployment before this happened. And, hunger is just sort of a norm in Haiti. Now you have this, you have a fragile, very, very fragile healthcare system. Essentially, maybe 200 hospital beds in all of Port-au-Prince, the capital, which has well over a population of 3 million people.
Unbelievable.
Vast numbers, tens and tens of thousands of people are living in urban slums. What does that mean? It means we take New York City, for example, and the density, multiply that by probably 1,000. Why that much? Because there are thin walls, because you've got families of up to 10 people living in one small room. No window, no ventilation, a door in, one door in and one door out. That is the same door. No running water, no sanitation. How fragile healthcare. Now you introduce a virus that is as contagious, infectious, and can be deadly into that environment. And what you have is catastrophic or potentially catastrophic. Let me just explain another underlying reason. We know that people that have other health issues, that have other what we call comorbidity, for example, obesity or hypertension, diabetes, are amongst the highest numbers of people that actually die of the disease. In countries like Haiti, and specifically in Haiti, we do see a lot of hypertension. We tend to see some diabetes, but what we see more of are very compromised immune systems to start with. Why are they compromised? They're underfed, they're filled with parasites, because they have no access to clean water or very limited access to clean water. You've got people who are essentially all the time have low levels of illness, and children with compromised immune systems. So again, the potential here is catastrophic. And if we don't get out in front of it and take the lead and try to do something, what we saw in 2010 in terms of up to 300,000 potentially die in that earthquake, we could see significantly higher numbers.
Yes.
It's just, it's beyond alarming.
Yeah.
Rachel, could I ask a question there?
Sure.
On the reporting, I don't know that the numbers in Haiti are very high at this juncture. How are they reporting? Do they report? What's the attitude of the people toward reporting sicknesses of any kind?
So, well, one, let's start with testing. First of all, you have to have tests to test people.
Right.
And, I know that Haiti did order some tests. I don't think they've even arrived. They have very few tests. Very few people will go to get tests. Why? There is a tremendous stigma against people with COVID-19 in Haiti. The few cases that they have on record, the reaction is, let's kill them. If we kill them, we will kill off the disease. So we're fighting this huge stigma. You can look at it potentially from the voodoo aspect of it. It's a lack of education. It's undereducation. It's lack of information. And it's also, you've got a government there with absolutely no credibility. So if the government is saying, look, we have a crisis, this is what we all need to do, people don't believe them. This government has lied to them during modern history. This specific government over the last few years has been incredibly unstable and has really misled the public. So you've got that factor as well. So people they have no money to go for healthcare in general. They have no money for testing. They're afraid, they'll be very afraid to get tested, because if they are positive and they're sent home or they're quarantined, their families could be at risk and they themselves can be at risk.
Yeah.
Great risk.
Not only Haiti, but Hunger Relief International also partners with the country Guatemala. Now, Susan and I love Guatemala. We've never been there, but there's one reason we definitely love Guatemala. It is this right here.
Oh, the coffee.
We love their coffee. We love their coffee. But with that said, truly, tell us a little. So Haiti, it's alarming.
Yes.
I want to talk a little more about that in just a moment. What specifically your plan, what you're doing, what your strategies are to help. But first, tell us a little bit about Guatemala, just an overview of what's going on there. What does it look like there? I think we've talked before, it's a little different.
It is different. It's interesting. The president of Guatemala is a physician, so he shut down that country early on. They put what do you call it? There were only certain times of day that people could go out. They still have these curfews. Now they've expanded them a little. It's from 4 a.m. to I think it's about 5 or 6 p.m. Other than that, everybody must stay in the house. Now, while most of our work is in the rural area, that's what I want to talk about. So the virus has not really reached a lot of the villages where we're working, and we are very thankful for that. And the villages themselves are kind of self-protecting. They're very wary of strangers. They don't want strangers coming into the villages. Very few people are leaving. Local leadership, community village leadership will go into town maybe once a week, pick up food, bring things back. Our biggest concern right now, one, is we are providing emergency relief to a number of families in the villages. Why? Because there are certain families that, you know, everybody's poor, but then you've got the poorest of the poor, and they have nothing to eat. We're getting our recommendations. We're getting referrals through the community leadership. We're providing weekly food baskets, and we're still expanding as the crisis expands. What we're really concerned about in Guatemala is, okay, this is planting season. This is a key time of year for them. This is corn planting in the next few weeks. If they don't plant, if they cannot plant, why can't they plant? Well, guess what? The large landholders are not planting right now. That means there's no day labor for these people. These are subsistence farmers that rely on what they grow plus a little bit of extra money they earn. Maybe if they're lucky, $2 a day, about half the year, $2 a day working on these large farms. Well, the large farms aren't planting. If the large farms don't plant, that money does not get earned. Now they can't plant their little plots of land that cover their families for the year. So if they don't plant now, okay, maybe they have a little bit to get by, but come October and through the next year, we're going to see degrees of hunger bordering on starvation.
Wow.
So it is of grave concern. What do we do? Do we provide emergency relief? How do you approach this? Because we don't want to deal with long-term hunger and children that literally are starving in front of us.
Well, and Rachel, as you describe this, you know, all of our hearts absolutely are impacted. And it's interesting how each of these countries, Haiti particularly, that Keystone has been a part of helping, but each of them are facing grave situations that look different in the details. And, you know I have been, you and I both have been to Haiti. Dr. Claude, you have done extensive work, boots on the ground, being in Haiti.
Yeah.
And Guatemala.
Yeah, and Guatemala for you.
And Africa.
Yeah.
And,
But the reality is, it can feel overwhelming. Even to hear the need, it can feel overwhelming. And we know that none of us as people are the ultimate savior and solution. We cannot do all that's required, but we can do something. And our church has always been a church that rises up to help and to do something. It's the heart of who we are. What are some of the ways right now? You know, HRI, you're on the front lines of this epidemic. You're on the front lines of bringing help. What are some of the specific ways right now that you're providing help in this unique crisis?
Okay, great. So let me start in Haiti. We were way out in front in Haiti. We saw this, we jumped on it. We've been doing an education and prevention campaign, but most importantly, what we're doing in Haiti is we are trying to reach upwards of 1 million people with hand washing stations. Our goal is to get people to be able to wash their hands with soap and water whenever and wherever in these slum areas and densely populated areas. We've already begun to put out these hand washing stations with soap. It's amazing. They don't touch anything. They literally push their foot down, the water comes out, the soap is there, they wash their hands, they take the foot off the pedal, and each hand washing station can handle up to 50 people a day. If we can get 400 to 450 hand washing stations, in 90 days alone, 1.8 million people will be able to wash their hands. Imagine that.
Wow.
We can't we can't socially distance them because of the living conditions, but we can help them. We can make sure they can wash their hands. We know that is so key. And if they want to wash them 10 times a day, wash them 10 times a day. They can do it. That's the beauty of it. The other piece that's so big is masks. We saw that coming. We reconfigured part of our office space. We trained some of our women in these communities that we work with their families and their kids, and they are producing masks. And our goal is to produce 3,000 masks over the next 90 days. And those masks, we eat the cost. But what we do is we then let these ladies, they get enough for themselves and their families, for free, of course, but then we want them to earn a living. So they then go out and take the masks and they sell them for themselves. We don't want any of the money. And they can charge, my goal is for them to charge about 50 cents to $1. I prefer the 50 cents. More out there, the better. But they'll do what the market, says. And right now it was, it's asking for a higher amount. So we're out there, we're in front. We have good health ambassadors, women we've trained, going from house to house, explaining to people, trying to beat that stigma. We're out there on the front lines. Our nurse is out there. Our social worker is out there. We're visiting people. We're making sure people are healthy, that they understand. We're trying not to breed fear. We're trying to educate, especially kids. What are they thinking? So we've got to do both. Explain, but not create fear. In Guatemala, what we're doing, we're desperately trying to help 100 farmers plant this year. Our goal is to help 100 farming families plant their corn and their beans this year so that come next year, they will not go hungry. And that's our biggest plan. We're doing education, we're doing prevention. We've got all sorts of social media platforms going on in Guatemala. We're working with big UN groups, but our biggest goal is let's help 100 farmers plant their corn and beans so they have food to eat a year from now, not even 6 months, so that they don't go hungry.
Wow, you guys, what a vision, what a vision. And if the heart feels the same, it really feels the same, that you just, I recognize it. When you saw it, you pivoted and you moved and you immediately began addressing those needs. We can't do everything. I love what you said. We can't do everything, but what can we do? And I know at Keystone, we're in a season where our people have been rising up, and we have been asking who needs help, and people have been raising the hand saying, I need help. We've looked for opportunities to try to meet different needs in our immediate community and in communities surrounding us, like Fort Worth, and now in our international community too. I appreciate you letting us know more specifically what those needs are, because there's a heart at Keystone Church that says, I can help. And that heart that says, I can help, I want to do something. Our church in this season has overwhelmed us with their generosity to say, if I'm in a position to help, I want to help. And one of the ways that we are helping in this season is addressing some of these specific opportunities to make a difference with Hunger Relief International. So I want to thank you for your vision. I want to thank you for working tirelessly to open up channels of blessing for others. And Rachel, just know that we are praying for you, that you have a church that's rooting you on, and together, we're not the saviors. We know that for us, we know that Jesus is the hope of the world. But man, Jesus said, how you treat the least of these, right?
Yeah, if we could just be his hands and feet, that is our heart and our desire with these children, to make that impact and to help.
One of the geniuses of partnering with HRI and Rachel Zelon, I have been with her in a lot of different situations, and always you're concerned about the return on your investment. How far is the bang of the buck going, and how far is the sweat equity going? And you're always asking that question. And one of the things I appreciate so much about HRI and Rachel is that she sees quick, she sees further, this leadership quality and makes it possible for you to do high impact efforts in conjunction with HRI. And so a church like Keystone, you really are punching above your weight because you are working with someone who knows how on the ground to get the maximum impact out of the effort and out of the dollar.
So
Yeah.
good. So good. And we're thankful for that. We believe that God is the one who orchestrates and
That's
takes
right.
our paths and crosses them together to make a difference. And
Yeah.
so it's so encouraging.
Well, thank you, Rachel, for joining us. I know you're blessing us with all this information, and we want to bless those that we can. And so we're excited to partner together in this season beyond what we're already doing with the meals. God bless you.
Yes.
And thank you for spending some time with us.
Thank you for taking the time, and thank you for being our partner. We could not do the work we do without the partners we have, and Keystone has been a great partner throughout the years, and I look forward to working together for years to come and changing lives and saving lives. I have always lived by one thing, because this is tough work, and that is to save one life is to save the whole world.
Mm-hmm.
And that's what leads me every single day. You know, you're right. We can't save everybody, but if we can save one person, if we can save one family, we've done it all.
Why don't we do this? Let's sign off this way. Let's just give each other a fist bump of unity.
Yes.
You're the best. God bless. Thank you.
Thank you. Take care. Appreciate it.